Hello everyone. Today I'll talk about the bony structures of the upper limb. I'll talk about the osteology of the upper limb. Okay, I will describe the anatomical features of each bone that constitutes the upper limb, and then in the next lecture I'll talk about the muscle attachment and some clinical correlates. Okay, so the skeleton of the upper limb can be divided into parts. We have the shoulder girdle, we have the arm, we have the forearm, and then we have the hand. Now for the shoulder girdle, it's made up of the clavicle anterior and then scapula posterior. So this is the clavicle is anterior, and then the scapula is posterior. Then the skeleton of the arm is the humerus. This is the humerus. Now the skeleton of the forearm is made up of the radius, which is lateral, and then ulna, which is medial. And then the hand can be divided into three parts: the carpal bones, the metacarpal bones, and then the phalanges of the shoulder girdle. We have the clavicle anteriorly, and then posteriorly we have the scapula. So this is the superior border of the clavicle, this is the inferior border of the clavicle, and this is the scapula. How about the clavicle? The clavicle. Now it is important to note that the clavicle is a long bone. The clavicle is a long bone, and it being a long bone means that it has two ends. It has the sternal end and it has the acromial end. So this is the sternal end. The sternal end is also called the medial end, and it has the lateral end. The lateral end is also called the acromial end. Now it is called the sternal end because it articulates with the manubrum of the sternum, whilst the lateral end or the acromial end articulates with the acromion of the scapula. It is important to note that the sternal end is larger than the lateral or the acromial end. Now the clavicle also has shafts. Now this is the shaft. This is the shaft of the clavicle. It can be divided into two parts. There's the lateral 1/3, that's from here to where the red arrow is, and then there's the medial 2/3. Now the junction between the medial 2/3 and the lateral 1/3 is the commonest site of fracture of the clavicle. The clavicle also has four surfaces. It has anterior surface, it has posterior surface, it has superior surface, and it has inferior surface. Now, how do we differentiate the superior surface of the clavicle from the inferior surface of the clavicle? So this is the superior surface, okay, and this is the inferior surface. Okay, you notice that for the inferior surface, there's a groove here, there's a depression here called the subclavian groove, which provides attachments for the subclavius muscle. There's also a tubercle here called the conoid tubercle, and also a depression here, or actually a line called the trapezoid line. So once you see this depression, okay, the subclavian groove, then you know that this is the inferior surface. Again, this is the clavicle. The clavicle has two ends. This is the medial end or the sternal end. This is the lateral end. We said the medial end is larger than the lateral end. Now the medial end is called the sternal end because it articulates with the manubrum of the sternum, okay, to form the sternoclavicular joint. This is the sternoclavicular joint. Okay, this joint is a saddle synovial joint. Now the lateral part, which is flat, is the acromial end or the lateral end. It articulates with the acromion of the scapula to form the acromioclavicular joint. Now this joint is a plain synovial joint. We've looked at the sternal ends of the clavicle, we've looked at the lateral end or the acromial end. So now let's look at the shaft. Now we said that there are four surfaces of the shaft. Four surfaces on the shaft. We have the anterior surface, we have the posterior surface, we have the superior surface, and then the inferior surface. The shaft can also be divided into two: the lateral 1/3, this is the lateral 1/3, and the medial 2/3. The medial 2/3 is convex anteriorly, the lateral 1/3 is convex posteriorly. Now the clavicle is the most fractured bone, and that fracture usually occurs between the junction between the medial 2/3 and the lateral 1/3. So this junction, this is where the fracture is likely to occur. Now for the inferior surface has three features. There's this impression here, okay, on the medial third, this impression for costoclavicular ligament. Now for the lateral 1/3, we have the conoid tubercle and the trapezoid line. The conoid tubercle for the conoid ligament, the trapezoid line for the trapezoid ligament, and both of them will come together to form the coracoclavicular ligament. Look at the functions of the clavicle. Number one, it connects the upper limb to the axial skeleton on each side, and also it transmits forces from the upper limb to the axial skeleton. Now, how do we differentiate the clavicle from other long bones? Remember, we said that the clavicle is a long bone. We said the clavicle is a long bone. It has two ends, the medial end, the lateral end. The medial end is called the sternal end. The lateral end is called the acromial end. Now, how do we differentiate the clavicle from other long bones? First thing is that it lies horizontally. Other long bones lies vertically. It lies horizontally. It has no medullary cavity. It is the first bone to ossify in fetal life. It ossifies in membrane, so it means that the ossification is membranous, not cartilaginous. And then lastly, it is the commonly fractured bone. Again, how do we differentiate the clavicle from other long bones? It lies horizontally. It has no medullary cavity. It is the first bone to ossify. It ossifies in the membrane, that's membranous ossification and not cartilaginous. And it is the commonly fractured bone. This is the scapula. This is the scapula. The scapula has three angles, three borders, three fossa, and then three processes. So, for the angles, there's the superior angle. See where my cursor is, the superior angle. There's the inferior angle, and then we have the lateral angle. Again, superior angle, inferior angle, and the lateral angle. Now, the superior angle is opposite the second rib. The inferior angle is opposite the seventh rib. And the lateral angle is called the head. Now, this head has three features. It has the glenoid cavity, which articulates with the head of the humerus to form the shoulder joint. It also has the supraglenoid tubercle and then infraglenoid tubercle. Now, there are three borders. This is the superior border. Then we have the medial border. Then we have the lateral border. Again, three borders. Superior border, which is the shortest. Then we have the medial border, which is also called the vertebral border. Then we have the lateral border, also called the axillary border. Now, the superior border, which is the shortest, has a notch called the suprascapular notch. Now, we'll talk about the three fossa. Now, this is the spine. The one above the spine is the supraspinous fossa. The one below the spine is the infraspinous fossa. And then this is the subscapular fossa. Again, there are three fossa. We have the supraspinous fossa because it's above the spine. We have the infraspinous fossa because it's below the spine. And we have the subscapular fossa. Now we have three processes. We have the spine. This is the spine. This is the spine. This is the acromion. This is the acromion. And this is the coracoid process. Okay, three processes. We have the spine, number one. We have the acromion, and then we have the coracoid. Now, the posterior border of the spine is also called the crest. It's called the crest. Now, medial to the crest is opposite T3 vertebrae. Again, this is the anterior surface of the scapula. This is the posterior surface of the scapula. We said that the scapula has three angles. This is the superior angle, this is the inferior angle, this is the lateral angle. We said that the superior angle is opposite to the second rib. We said that the inferior angle is opposite to the seventh rib. And the lateral angle is actually called the head. The head has three features. It has the glenoid cavity, which articulates with the head of the humerus to form the shoulder joint. We said that the head also has the supraglenoid tubercle, which is here, and then the infraglenoid tubercle. We said there are three borders. There's the superior border, which is the shortest. There's the medial border or the vertebral border, and then the lateral border, which is also called the axillary border. So the superior border has a notch called the suprascapular notch. Now this is the posterior surface, this is the spine, this is the acromion, this is the coracoid process. Superior angle, this is the inferior angle, this is the lateral angle. Okay, so the superior angle opposite the second rib, the inferior angle opposite the seventh rib, the lateral angle also called the head. So this is the spine, this is the acromion, this is the coracoid process. This is the superior border, which has a notch called the suprascapular notch. Let's know the bone in the arm, which is the humerus. The humerus. Now the humerus is a long bone. The humerus is a long bone. It's being a long bone, it has two ends and a shaft. It has two ends and a shaft. The upper end, the lower end, and this is the shaft. Now for the upper end has the head, okay, which articulates to the glenoid cavity to form the shoulder joint. And then it has the anatomical neck, just is a construction below the head of the humerus. Then we have the greater tuberosity, then we have the lesser tuberosity. Now in between these two tuberosities, we have the bicipital groove. Now below these two tuberosities, there's a neck, another neck here called the cervical neck. When we come to the lower end, we have two articulating surfaces and non-articulating surfaces. For the two articulating surfaces, we have the trochlea and the capitulum. This is the trochlea. The trochlea is medial, the capitulum is lateral. Then we have the two epicondyles. We have the medial epicondyle, and then we have the lateral epicondyle. Now we have three fossa. We have more medially the coronoid fossa, more laterally we have the radial fossa, and then posteriorly we have the olecranon fossa. Now the shaft has three borders and three surfaces. For the borders, it has the anterior border, the medial border, and the lateral border. For the three surfaces, it has the anteromedial surface, anterolateral surface, and then posterior surface. Again, this is the humerus. Okay, this is the upper end, this is the lower end, this is the shaft. Okay, so we look at the upper end. Okay, so this is the head of the humerus, which articulates with the glenoid cavity to form the shoulder joint, which is a ball and socket synovial joint. Now there's a construction beyond the head called the anatomical neck. Okay, so this is the anatomical neck. You can see it here too, the anatomical neck. Then we have the greater tuberosity, we have the lesser tuberosity. Now in between these two tuberosity, there's a groove here called the bicipital groove. Now there's another neck here called the cervical neck. Now it's called the cervical neck because it is susceptible to fractures. Now when we look at the lower end, okay, this is from lateral to medial. This is the lower end of the humerus. It has two articulating surfaces. We said it has the trochlea and then the capitulum. So because this is lateral, this is the capitulum. Capitulum articulates with the upper surface of the radius, and then the trochlea articulates with the trochlear notch of the ulna. Now this is the medial epicondyle, this is the lateral epicondyle. We said that it has three fossa. This is the coronoid fossa, okay, and then this is the radial fossa, and then posteriorly this is the posterior surface of the humerus. So this will be the olecranon fossa. Now there's a spiral groove here or a radial groove here. Okay, it's called the radial groove because it is related to the radial nerve. And then you can see a deltoid tuberosity here, which provides attachment for the deltoid muscle. Let's talk about the articulation of the humerus. Okay, what is the articulation of the humerus? The upper end, we said the head articulates with the glenoid cavity, okay, to form the shoulder joint, which is a ball and socket synovial joint. All right. Then the lower end, we said this is the trochlea, this is the capitulum. These are the two articulating surfaces. So we said the trochlea will articulate with the trochlear notch of the ulna, and then the capitulum will articulate with the upper surface of the head of the radius. Again, the upper end would articulate, okay, this is the head of the humerus. It articulates with the glenoid cavity. This is the glenoid cavity. to form the shoulder joint. And this joint specifically is a ball and socket synovial joint. The lower end, we said there are two articulating surfaces, the trochlea and the capitulum. We said the trochlea is medial, the capitulum is lateral. Okay, we said that this is the trochlea. The trochlea will articulate with the trochlear notch of the ulna, and then the capitulum will articulate with the upper surface of the head of the radius. Regarding the bones of the forearm, there are two bones, the radius and the ulna. Okay, so this is the radius, this is the ulna. Now the ulna is medial and the radius is lateral. Now the radius and the ulna, they are also long bones, and because they are long bones, they will have two ends. Okay, the upper end, the lower end, and then a shaft. The upper end, the lower end, and then a shaft. Let's look at the medial bone. Okay, the medial long bone in the forearm, which is the ulna. So we'll look at the upper end first. Now the upper end has two notches, and then two processes. Okay, number one, it has the trochlear notch. Okay, so this is the trochlear notch, and the trochlear notch articulates with the trochlea of the humerus to form the elbow joint. And then the other notch is the radial notch, which articulates with the head of the radius, okay, to form the superior radioulnar joint. All right. Then it has two processes, the olecranon process and the coronoid process. This is the olecranon process, this is the coronoid process. And then there's a tuberosity here, okay, called the ulnar tuberosity, just below the coronoid process, the ulnar tuberosity. Then there's a crest just below the radial notch called the supinator crest. And then just inferior to it, we have the spinator fossa. So again, what are the features of the upper end of the ulna? We have two notches and we have two processes. We have the trochlear notch, which articulates with the trochlea of the humerus to form the elbow joint. We have the radial notch, which articulates with the head of the radius to form the superior radioulnar joint. Then we have two processes. We have the olecranon process, then we have the coronoid process. Okay, then we have the ulnar tuberosity, we have the spinator crest, and then spinator fossa. Lower end of the ulna, okay, is made up of two main parts, the head and the styloid process. Okay, so this is the head of the ulna, this is the styloid process. Okay, now the head of the ulna, it articulates with the ulnar notch of the radius to form the inferior radioulnar joint. Okay, now this is the head of the ulna. Okay, this is the ulnar notch of the radius. Now the head of the ulna, it is important to note that it does not take part in the formation of the wrist joint. This is the carpal bones. It does not form part of the carpal bones because it is separated by an articular disc here. Okay, so what are the features of the lower end of the ulna? We said it has the head, this is the head, and then the styloid process. The head articulates with the ulnar notch of the radius to form the inferior radioulnar joint. We said more importantly that the head of the ulna does not form part in the carpal bone formation, okay, because it is separated by an articular disc. For the radius, okay, the upper end of the radius has three parts. It has the head, the neck, and the tuberosity. Okay, so this is the upper end of the radius. So this is the head, this is the neck, and this is the tuberosity. Now the head forms two joints. The upper surface of the head, articulates with the capitulum of the humerus to form the elbow joint. And the circumference, okay, where my cursor is, the circumference of the head would articulate with the radial notch of the ulna to form the superior radioulnar joint. Okay, so this is where the joint is, superior radioulnar joint. Now the neck is surrounded by a very important ligament called the annular ligament that helps to keep the radius in position. This is a very important ligament, annular ligament. Okay, it's around the neck. Now for the tuberosity or the radial tuberosity, okay, is for the insertion of the biceps tendon. Again, what are the features of the upper end of the radius? We have the head, the neck, and the tuberosity. Now for the head, it forms two joints. The upper surface of the head, okay, articulates with the capitulum of the humerus to form the elbow joint, and then the circumference, okay, of the head articulates with the radial notch of the ulna to form the superior radial ulnar joint. So this is where the joint is, the superior radial ulnar joint. Okay, now we said the neck is surrounded by a very important ligament called the annular ligament. So okay, this is the annular ligament, which helps to keep the radius in position. Then for the radial tuberosity, it serves as an insertion for the biceps tendon. The lower end of the radius, okay, the lower end of the radius, it has five surfaces. It has the anterior surface. This is the anterior surface. It's a very smooth surface. Then it has a very rough surface, which is the posterior surface. Now there's a landmark for the posterior surface, which is the dorsal tubercle. Now we have the medial surface, okay, forming the ulnar notch, okay, ulnar notch of the radius. Okay, this is the medial surface. And now for the lateral surface, it projects downwards, okay, to form the styloid process. Okay, projects downwards to form the styloid process. And then for the inferior surface, okay, this is the area for the scaphoid bone and then area for the lunate bone to form the wrist joint. Again, what are the features of the lower end of the radius? Okay, it has five surfaces. It has a smooth anterior surface. Okay, it has a rough posterior surface, and we said there's a landmark for the posterior surface, which is the dorsal tubercle, and this is the medial surface, okay, the ulnar notch, and this is the lateral surface, the styloid process. This is the styloid process, and then the inferior surfaces, okay, forms two bones, the scaphoid bone and then the lunate bone to form the wrist joints. Okay, this is the radius, this is the ulna. This is the radius and this is the ulna. This is the upper end of the radius. This is the lower end of the radius. This is the shaft. Okay, this is the head. This is the neck. This is the radial tuberosity. Now we have the smooth anterior surface. This is the styloid process, which forms the lateral border. This is the inferior surface for the scaphoid and the lunate. Okay, and then this is the rough posterior surface, and then the landmark is the dorsal tubercle. Okay, now this is the ulna. This is the upper end of the ulna. This is the lower end of the ulna. This is the shaft. Okay, this is the olecranon process. This is the coronoid process. Okay, this is the trochlear notch. This is the radial notch. This is the ulnar tuberosity, and then there's a membrane here that is connecting the radius and the ulna. It is the interosseous membrane. Skeleton of the hand. The skeleton of the hand has three parts. Okay, it has the carpals, the metacarpals, and then the phalanges. Okay, so these are the carpals, these are the metacarpals, and these are the phalanges. Okay, the carpals has 8 bones. Okay, the lower part of the bone arranged in rows. Okay, so 4 on each row. So 1, 2, 3, 4. Then we have 1, 2, 3, 4. So making 8 bones. So 8 bones for the carpals. Then for the metacarpals, we have 5 bones. 1, 2, 3, 4, 5. Then for the phalanges, we have 14 bones. 3 on each finger except the thumb. Okay, 3 on each finger except the thumb, making 14 phalanges. So regarding the carpal bones, okay, we have the proximal row and the distal row. The proximal row and the distal row. Okay, so this is the proximal row. Okay, we say we have 4 bones for the proximal, and then for the distal we have 4 bones. Okay, this is an acronym, yes, an acronym to remember the carpal bones. She looks too pretty, try to catch her. Okay, so let's look at the proximal row. Okay, from lateral to medial. So this is the scaphoid, this is lunate, this is triquetrum, and this is pisiform. Okay, so scaphoid is for she, lunate is for looks, triquetrum is for two, and then pretty is for pisiform. Right? Then let's look at the distal row from lateral to medial. The distal row, we have try to catch hair, and the bones are trapezium, trapezoid, capitate, and then hamate. Again, what are the proximal and then distal bones of the carpal, or the carpal bones? So for the proximal row, the carpal bones, we have scaphoid, we have lunate, we have triquetrum, and we have pisiform. For the distal row, we have trapezium, we have trapezoid, we have capitate, and then we have hamate. If you've learned a thing or two from this video, please like, share, and subscribe. I'll see you in the next video.